Back to you.
Jeff, thanks. Well, you know, how many times have you woken up with a shoulder or back pain? Some of you may have gotten up with one or the other this morning. You may want to blame it on old age, but it could be the result of another chronic problem. Dr. Tim Sklashivsky is with us, the National Spine and Pain Centers. He's with us this morning here to talk about myofascial pain syndrome, or MPS. But first of all, let's dispel the myth. It's not an old person syndrome, right?
Absolutely not. Basically, individuals can get it from school age all the way up until older individuals and anywhere in between.
So how do we not mistake it for an old age pain? How do we recognize the symptoms of MPS?
Well, typically when I talk with my patients after taking history and doing an exam, basically looking for sort of hints toward myofascial pain, which are pain usually for most individuals going to be in the neck and upper back. It's going to be a pain that generally gets worse as they actually either continue to do certain activities, type in a computer, as one example, or as the day progresses, that pain seems to just get worse and worse. Generally gets better as they rest.
And it's so important to listen to your body, correct?
That it is.
And so when you're experiencing these symptoms, how do you find relief?
Well, from my patients and the other doctors at National Spine and Pain Centers, what we'll do is there's a comprehensive treatment program that we'll do for patients who have myofascial pain. Generally, the go-to treatment is stretching, stretching, and more stretching. There are some other things that you can do, dry needling, trigger point injections, but the mainstay for treatment for myofascial pain is stretching.
Let's talk about stretching a little bit, because we were talking before this interview, and I was telling you that I listened to either a doctor or physical therapist said one time that she frowned on stretching. But stretching is valuable, particularly for MPS.
Yes, it is. For myofascial pain, when we talk to our patients, the one thing that I'll tell them is myofascial pain is almost like getting a Charlie horse or sort of a cramp in your calf or your hamstring. And so when that happens, you stretch it out. You'll see on the sports field, they'll pull their toes back and try to get that cramp out. And then the last thing you want to do is then go ahead and then start and do exercise or do resistive exercises. For myofascial pain, you want to stretch that.
Excellent. Dr. Z, as you're affectionately known, we appreciate the insights about MPS this morning. So don't blame that pain on just being old. Let's have